Good morning, everybody. First of all, I want to thank the first of the European Rhinologic Society, also on the Serbian ENT and Rhinologic Society. They did an excellent job, and we are very happy that we are collecting each other, I mean our Balkan countries. And today I want to open the session with the cystic fibrosis in childhood, and also what is the role of the functional endoscopic sinus surgery. You know that cystic fibrosis is a very difficult disease, and so many discussions, not so many publications, but anyway, we have to know, and when we have some children with this kind of problems, we have to know generally what we have to do it. Cystic fibrosis is autosomal recessive disorder with estimated incidence over 1 in 30,000 people. Where is the problem? We have defect of epithelial cell ion transport, and that's why we have viscous secretion, and immediately could be happened chronic rhinosinusitis, which we have increase of the CO retention, more inflammation, poor mucociliary clearance, mucosal inflammation, and osteometal complex obstruction. When we are talking the mucosal inflammation, so many publications we can find that the main pathogens which are in the nasal mucosa, we can find it. This is Pseudomonas aeruginosa and Staphylococcus aureus. One publication, it was published on the 2070 by Sobin et al. They reported that methicillin-sensitive Staphylococcus aureus most common pathogen and increase over time. But look very carefully, if patients with pulmonary methyl-resistant Staphylococcus aureus were more likely to be co-infected with pulmonary Pseudomonas aeruginosa, their conclusions are there is low moderate correlation between pulmonary and sinus pathogens in CF patients. Here you can see the results, and sinus culture by age, you can see starting less than 4 years with methicillin Staphylococcus aureus and resistant Staphylococcus aureus. Look what happened in the sinus culture more than 15 years of age, and we have privilege of the Pseudomonas aeruginosa, which is a big problem. And you know that the last publications are talking for the antibiotic resistance, and we have to know very well how to treat this kind of disease. And when we think for the differential diagnosis also, we have to think for primary ciliary dyskinesia and what is the difference between cystic fibrosis and primary ciliary dyskinesia. Of course, the both diseases, the autosomal recessive chromosome 7, but in primary ciliary dyskinesia we have a big discussion 6 or 7. And also diagnostic tests are very important. In the cystic fibrosis we are doing 2 positive sweat chloride tests and genetic testing also, and we have prevalence of the nasal polyps almost 50%. About the investigations, we are doing specific questionnaire and quality of life questionnaires in CF patients, such as rhinosinusitis outcome measure 31 and sinonasal 5 for children, and nasal endoscopy classically released thick mucous discharge with bilateral polyposis. Here you can see some CT scans of the patients with children with cystic fibrosis. This is coronal view of the paranasal sinuses of the blockage of osteometal complex, and also the other one, it's going to the orbiter. And first of all, we have to start with the medical treatment. And the medical treatment, normally we have so many drugs which we can use in topical corticosteroids, antibiotics, Dornase alpha, and nasal saline irritation, and Ivacaflor is reported a good result also. Ibuprofen, inhaled nitric oxide, bronchodilatators, mannitol, hydration, and physical therapy. Here you can see the one publication from last year that Ivacaflor improved quality of life. For these children, it's very important to keep their quality of life, and you can see the average score per questions, and here you can see the baseline on the 6 months, they have a better quality of life if we are using this Ivacaflor improves. What about the surgical management? We have some preoperatively goals and improvement of nasal airway breathing, clearance and lavage of mucosa to alleviate facial pain, allowance for more easy administered antibiotic therapy, and less frequent exacerbation of the rhinosinusitis. Here some patients with surgical recommendations are always made following interdisciplinary discussion and consideration of risk and benefits. It's very important to know that we have to work with these children in, like a team, because not just ENT to work together. We have to do everything together with some other subspecialties. And here you can see some histological pictures, which we can find that nasal polyps are totally different information in cystic fibrosis patients. About the surgery varies from minimal functional nasal procedure to eliminate obstructions caused by the osteometal complex to total sphenoidectomy and enlargement of all natural ostia. That's why ostium size here is much important. What is the role of functional endoscopic sinus surgery? FESS relieves nasal symptoms, decrease hospitalization, and assist with Pseudomonas aeruginosa eradication. A combination of FESS and culture decreased antibiotics, topical antibiotics, irrigation, and aggressive postoperative debridement. Here I can show you one publication, one study, which suggests modified endoscopic medial maxillectomy improved the effectiveness of nasal irrigations. About the management, it's very difficult, and management we have to, each one case we have to investigate very carefully, and also we have to manage individually. That's why, but generally we have to know that we have some suggested proposes therapy, of course, medical and surgical, hypertonic saline, Dornase, mycolides, also oral corticosteroids, topical antibiotics, ivacaflor, adenoidectomy, inferior antrostomy, and FESS, you can use maxillary antrostomy at infundibulotomy, and polypectomy. I recommend that quality of life in these children is very important, and when we have to stabilize our relationship with the parents, because if they have some problems, we have to discuss each one case, and we all the time we have to think for their quality of life. And while there are no gold standard in the treatment of CF-related sinus disease, if often included combination therapy with medical and surgical treatment. In conclusion, management of sinonasal diseases in cystic fibrosis could have a beneficial effect of the child's overall morbidity, realistic goals of therapy, and longitudinal relationship with child, family, otorhinolaryngologists, and surrounding specialists. Finally, you can find some more publication if you follow the website of the European Rhinologic Society, also online, the Rhinology Journal, and a new online Rhinology Journal, and you can find some new publications about the subject. And I want to invite you for the 15 years anniversary of the Bulgarian Rhinologic Society, which will be held in Starosel from 8th to 10th of November this year, and you're always welcome in our country. And of course, I want to invite you next year in Thessaloniki for the European Rhinologic Congress 2020, which will be held in Thessaloniki from 21st till 25th in Thessaloniki in Greece. Thank you everybody for your attention.